that one this week.
Emphysema is a condition that affects the small air sacs in the lungs called the alveoli. The inner walls of the alveoli weaken and will eventually rupture. This disease is one of the many collectively known as chronic obstructive pulmonary disorder.
These balloons represent a healthy cluster of alveoli. A person without emphysema has healthy functioning alveoli, meaning they're all roughly the same size and have a large amount of surface area for gas exchange. Unhealthy alveoli, as these ones, containing emphysema, are larger, which means there's less room for gas exchange. During exhalation, old oxygen can become trapped when the inner walls collapse, creating larger sections, and this doesn't allow for new oxygen-rich air to enter the lungs.
Did you know that 27.2% of people with COPD have emphysema? Now you know.
Emphysema may be caused by the inhalation of airborne irritants. As an example, cigarette smoke, marijuana smoke, and air pollution. All these things leave carbon residue in the alveoli. Looking at this balloon, you can see the shadows of the carbon deposits from the harmful particles that become trapped.
Risk for emphysema is increased with smokers. Symptoms usually become apparent between the ages of 40 and 60. Anyone receiving secondhand smoke is also at risk for getting emphysema.
The symptoms associated with emphysema include shortness of breath, gray discoloration of the fingernails and skin, and not being mentally alert. A person with emphysema often wheezes when participating in
Strenuous
activities, such as walking or possibly even walking up the stairs can lead you to a nasty smoker's cough.
The treatments for emphysema are inhaled medication, surgeries, and oxygen therapy. If you have a very severe case of emphysema, you may want a lung transplant. Consider the following, because out of all the things you can suck at, you suck at breathing.